Some controversial changes to Montana's Medicaid expansion requirements are now under fire. The Montana legislature extended the program this year, which continues government-funded health coverage for nearly 100,000 low-income adults in Montana.
The state was also told to add some new rules for those who qualify, but as Mike Dennison explains, advocates for the program say those requirements could be harmful to some participants.
The most controversial change says those covered by the program must have a job or meet community engagement requirements for 80 hours a month. Community engagement could be volunteer work, a drug treatment program, being a full-time student, or other activity defined in state law. State health officials believe they can verify that 3/4 of the people covered by Medicaid expansion either meet this requirement or are exempt from reporting. But that means as many as 26,000 may not, and will have to report themselves whether they do. At a hearing Thursday on the proposed changes, a woman whose adult son is unable to work because of chronic mental illness says that's a problem.
You must realize that some people struggle with their intellectual disabilities to a point where they find paperwork or the task to understand program requirements so difficult that they walk away. They jeopardize their critical medical care, which helps stabilize their illness.
A speech pathologist who works in Pend Oreille County in north central Montana also said meeting the community engagement requirements may be difficult for many low-income parents in rural areas.
When they or their children need medical care, they have to come up with the gas money, transportation, and time off from an hourly job if they have one to get to Conrad or Cut Bank, a good 35 minutes to an hour away. From my point of view, adding the work requirements and increased premiums are punitive. Let's not make it even harder for them to take care of their families.
These eligibility and other changes must be approved by the federal government, which pays for 90% of the $750 million a year program. The state will submit its request to the feds at the end of this month, and there's no timeline for when it may be approved. State officials say they'll take into account testimony from the public, but the changes in the waiver are spelled out in state law as approved by the legislature in April. So how much leeway do state officials really have to adjust these proposed changes? If they're going to follow state law, probably not much. Reporting from Helena, Mike Dennison, MTN News.